The child began to develop, and the brain was there, vulnerable, and the environment and genetics could affect it.
In the medical community, when you ask about Dr. Bruce Buehler, giant in the field of pediatrics is often the response.
He changed the course of so many things, particularly for children with disabilities, right? That was his love, that was his focus. And he worked at every level. You know, he worked with the people at the state organizations, that sort of stuff. He was a great resource for them. They loved him too.
Dr. Buehler was born in Ohio and grew up in Chicago. He attended undergraduate and medical school at the University of Florida. After an internship back in Chicago, he served in the U.S. Air Force. He returned to the University of Florida for a fellowship in genetics and served as chief resident. He then taught and worked with patients in Utah, all before moving to Omaha in 1981, where he joined the University of Nebraska Medical Center and Children's Hospital and Medical Center. Genetics connected everything Dr. Buehler achieved during his career that spanned nearly 50 years.
He knew, and all of us knew, that genetics was where medicine should go. And so now it is there, right? So again, there's almost nothing you can do in healthcare that you don't need some sort of working knowledge of genetics. And so it is the basis of everything, right? It's the basis of disease, it's the basis of treatment and its responses. And so what Bruce did was he, way before his time said, let's make this the forefront of what we're doing.
Dr. Buehler served as director of the UNMC Monroe Meyer Institute and chaired the UNMC Department of Pediatrics for nearly 3 decades. He was an administrator with a vision, a catalyst for the betterment of healthcare through many avenues, including interdisciplinary care and expanding access.
Very early on, Bruce and I were very aggressive in setting up outreach networks. He and I would alternate. Once a month, one of us would jump in the car and we would be on the road for 8 days, and we would do a clinic a day. So we'd start in Omaha, and the next day we'd be in Grand Island, and then Kearney, and then North Platte and Scotts Bluff. And then after we'd done this for a few years, there was no geneticists in South Dakota. And so I gathered up contracts and then we'd go up into Rapid City and Pierre. And so we'd be gone for 8 days, do 1,800-mile loops, and see kids all along the way.
At a national level, he was a very well-known pediatrician and geneticist, very well-known in disability circles, very well-known in pediatric circles. As I say, I knew him from my days with AMSPDEC, the Pediatric Chairman organization. Still, people talk about him. As a clinician, he really helped transform and make available genetic services across the state. His clinics were highly regarded.
He never wore a tie, but he did wear cowboy boots.
Bruce was a cowboy. He always wore cowboy boots. He had custom cowboy boots, and a lot of times in meetings, he just put his boots up on the table, which was just hilarious. He'd do that even to the higher administrative people. He
Hated some of the administrative nonsense. He would have a more colorful name for it. He bragged, for example, that he got written into his contract that when he became chair of pediatrics, he would not have to wear a tie to the meetings. And so many of us don't wear ties in his honor.
This is a different disease.
Many remember his sense of humor and fun-loving nature just as much as his skill and drive to improve the future for children. He was down to earth and downright fun to work with. Dr. Schaefer remembers the time he returned from an outreach trip to South Dakota and placed wall drug bumper stickers on Dr. Buehler's car. He showed this photo in a group meeting about the trip.
It was the funniest thing in the whole world. He tried for about 2 seconds to act calm, but then he jumped up and had to run out to the parking lot to see if I just destroyed his new Porsche. But I'd already taken it off because I just put it on with sticky tack, so his car looked fine.
Dr. Buehler mastered the secret recipe to building deep, meaningful relationships with children and adults alike.
He was a remarkable guy. He was well-read in a variety of subjects. He developed a strong sense for complementary and alternative medicine in his later part of his career and edited a journal in that area. He was very interested in things outside of medicine. He was a chef, knew all the major restaurant owners and chefs in the city.
Dr. Bruce Buehler passed away in 2018. Much like the programs and legacy he helped craft, There are many Bruceisms that stand the test of time.
Patients loved him. He was a good teacher. When he gave me my first job as an administrator, he told me, he said, Brad, he said, the best thing that prepares you to be an administrator is to be the parent of adolescent children. And I thought, and over the years you learn that's absolutely true.
What the Academy is saying is,
His philosophies, visionary leadership, lessons, and compassion all live on.
He had an amazing ability to make friends and support and love and be loved by his friends. And he was a giant in the field and dearly missed by those of us that are left behind.
Every time I look around here, I see how we've grown, and that was part of his dream and his vision.
I think Bruce would just say, yeah, I worked my tail off. This is what I wanted to happen. This did happen. Thanks for acknowledging that. That's the sort of guy he was.
One of a kind, beloved, a pediatric legend.
the hope is that we can provide the best care as science, medicine, education to maximize the ability of all the children we deal with.